Star Vascular Interventional is an outpatient clinic, so it's not a hospital. That means that when you come here, you're going to be the center of attention. Any patient that comes in, they can park right in front of the building. There's one place to go. They're not going to get lost between the different buildings or different floors. They come to us, and they're going to be the center of attention. So it's one-to-one kind of care that we provide. There's no big waiting room to wait here for hours and time on end to be called in. You come in, you get checked in, you get seen, you go home. It's very efficient. So uterine fibroids are growth in the uterus. These are normal growth, meaning that they are not cancerous, but they're not normal in the sense that the tissues have responded abnormally to the hormones. So there are certain areas of the uterus that have grown because of exaggerated response to normal female hormones.
Sure.
Those growths are called fibroids. There are many treatments for them, and we offer a specific, very particular, very effective treatment here in our clinic. That's a very good and a complex question. There is no specific cause for it. It can happen in anybody. More common in black women, but again, it can happen in anybody. It happens predominantly in the perimenopausal female, as
Sure.
they have the hormonal stimulations. Those areas of the uterus grow and become this fibroid or specific growth within the muscle of the uterus.
Sure.
Again, the good thing is they're not cancerous.
Okay.
So we don't worry about them converting to cancers or becoming dangerous. Absolutely, yes. Blacks, African Americans, they get it more than Hispanics can get it. Whites can get it as well, not as much as the other ethnicities, but anybody can get it. So when the fibroids grow, there's typically not one fibroid. There are multiple areas of the uterus that grow to these hormonal stimulations. There are two kind of symptoms that can arise from these fibroids. One is because of the large size of the fibroids. The fibroids can grow to become really big. And because of their size, they can push on adjacent organs. For example, if they're large enough that they push on the bladder volume goes down, so we cannot hold as much urine in it. There's going to be frequent urination, frequent travels to the bathroom. If it pushes on the rectum, it can cause constipation.
Sure.
If it pushes on the veins in the pelvis, it can cause pressure and pain. So that's one category of symptoms that can arise from them. The second category is abnormal hormonal stimulation. So they react abnormally to the fluctuations of hormones. That means that the menstrual cycles could be much longer than usual. The bleeding during menstrual cycles could be much, much heavier. And sexual activities could be painful. This menstruation symptoms can be very, very severe. So if they are not as large and they do not produce severe symptoms, you can safely ignore it.
Sure.
Do nothing about them. There are some medications that can mildly help provide mild benefits, but as soon as you stop those medications, the benefit goes away and the symptoms come back.
Sure.
On the other end of the spectrum, you can have a surgery, such as a hysterectomy, and remove the entire uterus. It's a big surgery. It's a long recovery. It could be painful. If the fibroids are large enough and at the surface of the uterus, you can have a surgical intervention called myomectomy, in which they only pluck out the fibroids,
Sure.
only the ones that they can see. Still a surgery, not as severe and involved as hysterectomy, but still some recovery involved. And the smaller fibroids, or those that are inside, deep inside, cannot be removed. Then there is this other procedure called Uterine Fibroid Embolization, or UFE for short, which is a minimally invasive procedure, which is typically an excellent choice for most. Hysterectomy, if it's a big surgery, there's going to be a cut, the entire uterus is going to be removed, so there is no chance of fertility, the usual physiologic functions are lost. And then the recovery, there's a big surgery, there's a big recovery, it's a prolonged recovery. It's painful, and so after the surgery, getting back to a normal level takes a long time. Myomectomy is also a surgery, not as involved as surgery. Typically, there's no big cut. There are a few smaller holes that they go through. The problem with myomectomy is they can only see the fibroids that they can see, so they're superficial on top of the uterus. Again, if they're deep inside the uterus, they cannot be seen, they cannot be removed. And when there are larger fibroids, there are almost always smaller fibroids that we can't see, but if you give it time after a few years because of the hormonal stimulation, they would grow and become a problem. So with myomectomy, we cannot take care of those smaller fibroids. UFE stands for Uterine Fibroid Embolization. It's a minimally invasive procedure in which we cut off the blood supplies to the fibroids. Because there is no blood going to the fibroids, there is no nutrients supplying those fibroids, they stop growing and slowly shrink. A UFE procedure, or uterine fibroid embolization, is an outpatient procedure. So patients come in, have the procedure done, go home the same day. The procedure itself is not painful. It's a small catheter that is placed in the wrist to do the procedure through. The catheter, just like a catheter we place in the, for example, elbow in the vein to do blood draws or give IV medications. A similar size, tiny needle, tiny catheter. Everything is done through that. When we're done, there's just a small Band-Aid or small dressing on the skin. No cutting, so no dissection, no pain. The procedure takes about less than an hour. And after the procedure, patient can go home and recover. So there are some benefits compared to those. And there are some risks associated with any procedure, including UFE. UFE is one of the safest procedures that we can do. So there is the risk of bleeding or risk of infection or risk of non-target embolization. They do exist, but they're really, really, really small, less than 1%.
Sure.
Compared to hysterectomy and myomectomy, because there is no cut, because there is no dissection, the pain is not even comparable. This is not a painful procedure. And the risk of bleeding and causing infection is much less. UFE treats all the fibroids, the small ones, the large ones, the one we see, the one we don't see, the ones that are on the surface or deep inside. All of them get treated. So after the procedure, the first 3 days or so, there are going to be some cramps. And that's because when the blood flow to the fibroids are cut, the fibroids feel it. There's no blood going to them, so they react. And there's going to be this cramping and contraction sensation. It's going to be similar to those bad cramps that patients get during their menstrual cycles. The cramps last for 3 days. After that, it subsides and goes back to normal. It's not pain, it's just pressure and discomfort and cramping sensation. To help with those cramping, we do a nerve block that cuts down the severity of those cramps, but there's still going to be some cramps for 3 days. Any procedure, any medication, anything we do in medicine comes with some risks. Nothing is purely benefit or purely risks. So this is not an exception. It does come with some risks, but again, this is one of the safest procedures we do. Risk of infection, risk of bleeding, risk of problem when we insert the catheter. Those do exist, but putting it all together is going to be less than 1% possibility. The procedure is very successful if you select the patients correctly. 9 out of 10 patients or higher that have fibroids can benefit from this procedure, and this procedure is going to provide an excellent outcome for them.
Sure.
So before we do the procedure, we provide a consultation, a clinic visit, to make sure that the patient is a candidate for this procedure. Those 1 out of 10 that may not be a good candidate for this, we talk to them and direct them to a better treatment. But 9 out of 10 that would benefit from this would definitely benefit from the procedure. So the outcome would be excellent for them. If the fibroids go untreated, the good news is they do not become cancerous or spread elsewhere in the body, but they can keep growing and they can get to a size that are so large that they can push on the bladder. Bladder volume goes down to 0, meaning that you have to be in the bathroom every half an hour. Constipation, pain, a lot of pelvic pressure. And then a lot of people have so much bleeding during their menstrual cycle because of this fibroids that they become anemic, low in blood. They would require blood transfusion and iron infusion. Because of their size, and because of the amount of bleeding during menstrual cycles that can happen from them, they can become very serious problem. It's different in each person. Some people have minimal side effects and problems with these, and some have severe problems with this. And the blood level go down to a very low, critical, dangerous level. First of all, if you have pelvic pressure, prolonged heavy menstrual cycles, low blood level, or you have problem with constipation and urination, they can all be signs of fibroids. And checking for fibroids is very simple. It's a ultrasound examination that takes only 10-15 minutes to do. Is an outpatient procedure, not invasive. It's a very quick procedure, and they can tell you if you have fibroid or not, how many you have, how large they are, and if they're problematic or not. If you do have fibroids, then you can schedule a clinic visit, and we'll talk to you to make sure we provide the best treatment for it.